So our next speaker doesn't need much of an introduction, Dr. Bill Aronson. He's a professor of urology here at UCLA. He's been really one of the leaders in the area of nutrition and prostate cancer and its impact and how we can make a difference. He's going to talk about his recent work on translating some of the laboratory studies he and his colleagues have done into a clinical trial.
Where's the, Rob, where's the, I'm not a PC user. How do you get it to the...
Yeah. Let's see, where's the...
There it is. I got it. I got it.
That should do it.
There she is. Thanks. Thanks, Rob. Good morning, everyone. Thanks for including me amongst this illustrious group of speakers today. I'm going to talk a little bit about our translational research that we've been doing in fish oil and dietary fat and prostate cancer and kind of bring you up to the present. We're specifically going to talk about the type of dietary fat, the omega-6, omega-3 fatty acids, a little bit on the epidemiologic, preclinical, and clinical findings in this area. We're going to talk about the GPR120 receptor potentially mediating some of the effects of the omega-3 fatty acids on prostate cancer, our ongoing active surveillance trial, and some new ideas that we have that we're working in collaboration with Dr. Lily Wu in terms of the effect of omega-3 fatty acids on tumor-associated macrophages. And so as a brief review, when we talk about dietary fat, there's the saturated, the monounsaturated, and the polyunsaturated. And where we've been focusing our interest and where most of the literature lies is in the polyunsaturated. Now, the omega-6 fatty acids, the primary one in our diet from corn oil is linoleic acid. It represents 85% of the fatty acid, polyunsaturated fatty acid consumed in the American diet, baked goods. It is the backbone of our diet. We consume an enormous amount of corn oil. The omega-3 fatty acids, on the other hand, is at much lower level in the American diet. The DHA and EPA are from fish oil, and that's where we've been focusing our research. The typical ratio of the 6 to the 3 in the United States is 15 to 1, whereas it's 4 to 1 in the Asian diet, where there's a lower incidence of prostate cancer. And so if we briefly look at some of the epidemiologic studies, the intake of marine-derived omega-3 fatty acids is associated with a decreased risk of mortality from prostate cancer. There have been 2 relatively recent studies suggesting that DHA levels, that's an omega-3 fatty acid from fish, may be associated with an increased risk of high-grade prostate cancer, but there's a number of important shortcomings in those trials. And recently, a meta-analysis that included their data and other data together refuted those findings. But it is certainly something which is on our patients' minds. And when I'm recruiting patients to clinical trials, periodically they ask me about that, and I need to explain the full story to them. Now, we have repeatedly seen in our lab, and others have seen, that the omega-6 fatty acids from corn oil stimulate tumor growth. Here's an example of a xenograft study that we did, where clearly high corn oil stimulates the growth of LAPC4 tumors. Now, we've also seen this and reported this in castrate-resistant prostate cancer. So if you lower the omega-6, you delay the time to castrate resistance and you delay the growth of these tumors. And we've also used this and published this in the CMYC model that we've been talking about. And we've seen that also when you lower the omega-6, you delay the development of prostate cancer in CMYC, and you also lower the proliferation rate in the PIN lesions. So this is something that we've seen over and over again with corn oil. Likewise, what we've shown and others have shown is that if you compare an omega-3 diet to an omega-6 diet, the omega-3 deriving from fish clearly decreases the progression of xenograft tumors. Likewise, this work was also done by Hong Wu and her collaborators using the P10 knockout model, where they showed a similar finding. And what was interesting there is they as part of their work, they also used a desaturase enzyme, inserted it into the mouse, which converts the omega-6 to the omega-3, and saw a reversal of the effect. So that was more elegant work, really supporting what we and others have been interested in. And so we then translated the preclinical work forward and conducted and subsequently published a prospective randomized trial where we took men with localized prostate cancer scheduled for radical prostatectomy, and they were randomized to either a Western diet with an omega-6, omega-3 ratio of 15:1 versus a low-fat diet with fish oil capsules. And so we combined the diet with the capsules to obtain a favorable ratio, the ratio that we're interested in of the omega-6 to the omega-3. And then studies were subsequently done. First of note and interesting is that the low-fat fish oil diet increased the omega-6, omega-3 ratio in both malignant and benign tissue. So the dietary intervention was reaching the target organ, was reaching the prostate. Secondly, really the key findings which we found was that the fish oil diet had reduced proliferation as measured by Ki-67 relative to the Western diet, and that was in the radical prostatectomy tissue. Likewise, in a follow-up study, we looked at the cell cycle progression score and also saw a significant decrease in that as well in the fish oil versus the Western diet group. The cell cycle progression score is produced by Myriad Genetics, and it looks at 31 gene markers, and both Ki-67 and the cell cycle progression score are clearly shown to be correlated with progression and death from prostate cancer. So these are important markers, and this has really formed some important baseline data supporting our work moving forward. And so the real question that we then asked ourselves is how did the diet and the fish oil decrease proliferation? How did this happen? And our hypotheses at that time were affecting the COX-2 prostaglandin E2 pathway and the IGF pathway, and we saw neither of those appeared to be involved in what we saw. Was it a direct effect on epithelium, possibly the stroma or microenvironment effect, maybe on the immune system? And right at that time, my close collaborator, Hasi Cohen, he works closely with Gerald Alefsky at UCSD, and right about that time, Dr. Alefsky published a study in which they described GPR120 as a fatty acid receptor mediating anti-inflammatory effects as well as sensitizing effects. And so through this pathway, they saw the stimulation of GPR120, which is now also called free fatty acid 4 receptor, with omega-3 fatty acids caused broad anti-inflammatory effects in monocytic cells. Omega-3 fatty acids improved insulin resistance in mice on a high-fat diet, but not in the GPR120 global knockout mice. They saw it repressed macrophage-induced inflammation and decreased inflammatory factors coming out of this pathway, IL-6 and TNF-alpha. And then moving forward, the anti-inflammatory GPR120 effects, our working hypothesis is that this may be one factor mediating the fish oil effects on prostate cancer development and progression. And so we went ahead and have studied that in a variety of ways, and I'm not going to go through the details of all the tissue culture studies, but basically we found that GPR120 was present in a number of macrophage cell lines and also THP1-derived M1 and M2 macrophages. It's also present to a variable degree in prostate cancer cell lines, including MICCAP cells. And DHA is again an omega-3 fatty acid from fish oil, inhibits growth of prostate cancer and the macrophage cell lines in tissue culture, and knockdown of GPR120 partially reverses that effect in tissue culture as well. And so the bench work suggests that GPR120 may indeed be important. As far as human studies, when we just stain radical prostatectomy tissue for macrophages, we see that a subset of those also stain for GPR120, that is macrophages in the stroma next to the tumor. So we do see that in human tissue. When we did laser capture dissection of the specimens from the previous clinical trial that we discussed, and when we laser captured out the stroma, we also saw within the stroma compartment a decrease in IL-6 in the fish oil group as opposed to the Western diet group, suggesting that mechanism may be functional, although other markers that we've looked at have not shown those positive findings. And so then we asked the question, could it be that for more personalized nutritional therapy, is it possible that patients with higher GPR120 levels will be more responsive to a fish oil intervention? Can we select out patients who will be more responsive and have more effect on those patients? And then we went back to the archived tissue that we had from our prospective randomized trial. We saw no effect in the Western diet group, but interestingly, when we looked at the laser-captured stroma, the higher the GPR120 gene expression in the low-fat fish oil group, the lower the Ki-67 that was seen, suggesting that indeed maybe we can select out patients. And this is now a hypothesis that we have that we're testing in our next clinical trial. And so our overall ideas are that with the fatty acids from fish oil, that there's a direct effect on stromal macrophages, decreased inflammation, and potentially decreased prostate cancer proliferation. And so we're now testing this hypothesis. We've now translated this work forward to a prospective randomized trial that we're conducting, in which prostate cancer patients that are on active surveillance with Dr. Marks at UCLA are being randomly assigned to either it's a one-year trial, either a low-fat diet with fish oil to obtain an omega-6, omega-3 ratio of 3:1 versus a control no dietary intervention group. So we're right at the point in the field of prostate cancer where we can do a study like this. Previously, if we did serial biopsy studies of the prostate, we didn't know where we were biopsying with any precision, and then we were unable to compare the pre to post biopsies. But now, thanks to the expertise of Dr. Marks and also his team in our imaging court, Dan Margolis, who's a leader in the field of MRI, we're now able to identify the cancer better and do serial biopsies of the same site. And so we're studying this tissue at 1 year with the primary endpoint being comparing Ki-67 between the groups. We're also, as secondary endpoints, looking at the cell cycle progression score, whether GPR120 staining predicts response, and also looking at other surrogate biomarkers that we're interested in. So far, we've enrolled 13 patients into this trial, and thanks to Dr. Marks's absolutely superb clinical trial team, we are enrolling on track and extremely well, thanks to Jason Wu, Malou, and others in his group, which we're extremely grateful for. In any case, moving on to one other idea or area that we're interested in with fish oil. When we were doing the tissue culture work, looking at M1 and M2 macrophages and GPR120, Pei in our lab developed a way to generate the M1 and M2 macrophages, and this has previously been done from THP1 leukemia cells. But in any case, we are working with both M1 and M2 macrophages, and interestingly, at physiologic levels, the DHA inhibits the growth and induces apoptosis in both M1 as well as M2 macrophages. And so this is how Pei generates the macrophages in the lab, the M1 and the M2. And the story behind behind M1 and M2 macrophages is they're normally involved in wound healing. M1 is pro-inflammatory, M2 is involved in the wound healing process, but this is also appears to be critically important in a variety of malignancies where M1 macrophages lead to immune stimulation and tumor suppression, whereas M2 macrophages, in addition to inducing angiogenesis, lead to immune suppression and promote tumor development, progression, as well as metastasis. And so it appears that the M2 macrophages really prevent the host from mounting an immune response to the tumor. The work done on warm autopsy studies, for example, found that if you look at the tissue, first of all, the majority of tumor-associated macrophages are the M2 type, and up to 40% of cells in prostate cancer bone mets, for example, are M2 macrophages on the warm autopsy studies. Likewise, there's a number of clinical studies that have been done. We did one of these looking at TAM infiltration being associated with more aggressive prostate cancer. And the majority of the studies support that. This field of TAMs is important in a variety of malignancies and is more developed in the field of breast cancer, as best as my reading on the subject goes. And so we're now developed a model, and Lily Wu's group has been enormously helpful with this, where now we're using an immune-competent allograft mouse model to evaluate the effect of fish oil on host immune infiltration. And so the model we're using is the MIC-cap cells injected subcutaneously in immunocompetent FBB mice. Now with this model, if you look at the tumor tissue, so this is androgen sensitive, we do see a very significant macrophage infiltration, which by flow cytometry is predominantly the M2 type. And so what we saw in our first experiment is that the blue bar is the omega-6, the red is the omega-3. We saw a significant decrease in growth in the omega-6, in the omega-3 versus the omega-6 group. So there's two interesting parts to this curve. One is here, where we clearly see a separation, but the other is here, and when we last had our meeting with Hasi, he pointed out that it's interesting, the delayed effect suggesting that this may indeed be immune cell involvement and leading to this delayed response with the host mounting an immune response. And so then we've looked at a number of markers, for example, gene expression in the tumors, and when we look at that in the fish oil, in the omega-3 versus omega-6 group, we see decreased markers for macrophages overall, M1 as well as M2 macrophages, and we also see decrease in the MCP1, which is CCL2, a chemokine for M2 macrophages, as well as a number of other cytokines of importance, and likewise we saw downregulation of the NF-kappa B pathway in the tumor tissue as well. And so in summary, we see that fish oil may potentially inhibit TAMs. Now, we do think this requires further confirmatory studies, but dietary alteration of macrophage polarization may potentially be an adjunct to established therapies for prostate cancer. So we now consider this a form of nutritional immunotherapy. As far as future directions, we're working on defining the role of dietary fish oil intervention for men on active surveillance, determine if GPR 120 status predicts response, and also define the effect of omega-3 fatty acids on host immune response and tumor-associated macrophages. And so thank you for your attention. Yeah, of course.
Thank you for that. As you know, our foundation is very interested in nutritional therapy in general. We're actually, and you probably have heard about this research, Andy Dannenberg and Cliff Hudis received a challenge award from our foundation last year to extend the breast cancer observation to prostate cancer. And these are the so-called crown-like structures that, unless the pathologist is looking for them, he or she won't find them. And they describe this really well. And what it is it's an organized macrophage infiltrate that is almost like, I call it the atherosclerosis of cancer, which may be very similar to what you're observing here. And the question is, and these crown-like structures in breast cancer were associated with poor outcomes. So the question is, can you affect a lifestyle change that will change that course? So, my suggestion and question to you is, number one, have you seen this? Have you looked for it? And number two, your active surveillance cohort, which most people consider the best with the imaging that Dr. Marks does and all of the nutritional interventions that you lead. Is this something you might be interested in thinking about looking at or applying to your cohort?
So absolutely. I can assure you this afternoon at lab meeting, we're going to look heavily into this. I look forward to speaking with your investigators at the upcoming meeting, which would be great also. I don't know that we're going to see these crown-like structures in the prostate biopsy tissue, but we do have a very valuable resource of radical prostatectomy archive tissue, which we need to talk about going back and looking at, where we do see significant macrophage infiltration. So I really appreciate those comments.
Just make a comment, because I think what Andy Danberg said is he's looked at the lymph nodes and the fat associated with the radicals, so that might be the best opportunity.
Okay, thanks. Yes, sir.
So, Bill, the receptor, really interesting, distribution, and you measured that one predictive marker, the level of the receptor, presumably from infiltrating macrophages. It strikes me as kind of a tough measurement because where you biopsy, how much contaminating or infiltrating macrophages. But I was wondering, is there any data on any kind of DNA-based polymorphism in the population that might, from a simpler type of measurement, reflect what's going to happen in the whole body?
So we do anticipate that being challenging, that marker. There is not a lot of that as far as polymorphisms. There is one for GPR120, which is associated with obesity, but it's a very, very low incidence. It's very rare, and so it's not. We talked about looking at those, and I don't know of any right now. We also meet with Dr. Alefsky on a regular basis and keep making sure that we're updated on exactly what's going on, and that's been enormously helpful. Yes, sir.
I feel that was a wonderful talk.
Okay, thanks.
Very educational. Do humans express the enzyme which converts omega-6 fatty acids to omega-3 fatty acids? Is that a regulatable target?
Yeah, not in any state. No, the omega-3, they are essential fatty acids, so they have to be, there may be some, but not a significant amount. The omega-3 are essential fatty acids, and they only come directly from the diet. Okay, thanks.